In the way back.
I think we all try and give our kids balanced meals, but I'm not sure at which point one needs to supplement that with vitamins and minerals. So I'm kind of juggling between trying to make sure that I have a balanced meal for my child. I have one very picky eater and one very balanced eater. But I don't know at which point, I don't see any problem. So I don't know whether they really need this stuff, or I'm just getting carried away and giving the calcium and giving the extra, fish oil and all that stuff. So
right.
Is there any way of figuring out that
whether they need it?
Whether they need it?
Well, one thing that we monitor in children and adolescents is their growth and their weight gain. And if things are going along fine in that area, you can rest assured that they're getting enough of the macronutrients, protein, calories, and that sort of thing. In terms of the micronutrients and vitamins and minerals, I think much of the population is in that range is probably fine, depending on, like you said, you may have a picky eater that might be missing some things. Over time, though, over a week's time, most people tend to get a varied enough diet that they're achieving their needs. But I think a multivitamin and a calcium supplement is fine for everyone. Just to rest assured, it might put your mind at ease. And you can choose something that just provides 100% of the RDI, over-the-counter vitamin, and then an additional 500 milligrams to 1,000 milligrams of a calcium supplement, something like Viactive or Oscal or Citracal.
Thank you so much. I'm going to ask everybody, if you have questions, why don't we actually hang on to them, because the panelists have informed me that they probably are able to build off of some of these questions and more comprehensively give us an entire scope of dialogue around this that we could then circle around at the end. So if you'll sort of make note of your questions, perhaps we can more collectively address the scope of the questions and do so in answering them more comprehensively at the end. So we'll try that approach. So moving on, we will be hearing from Leah Zielcita. And Leah is a physical therapist at Packard who divides her time between the outpatient clinics as well as the hospital setting. She received her undergraduate degree from Loyola Marymount University in LA and went on to Mount St. Mary's College in LA to obtain her doctorate of physical therapy. Prior to joining Packard, Ms. Zielcita worked as a physical therapist at St. Mary's Medical Center in San Francisco. She's also a member of the American Physical Therapy Association, and her interests include dance and yoga, which have furthered her appreciation of posture, alignment, and movement. So I'm sure we'll all sit up straight and enjoy this presentation. Leah.
Hi, good evening. Can everybody hear me? Okay. Thank you for coming. I'd like to spend probably the next 10 to 12 minutes talking about back safety, and I'd like to provide some information to help your children maintain a strong and healthy back. I think it's important, as we're finding that the incidence of reported back pain in children is starting to rise. And so my hope tonight is that by offering you some extra information, you can help your children maintain good posture and prevent back pain now as either in their childhood, adolescence, and in the long term in their adulthood. So, to do so, I'd like to talk about three main things. First is I'd like to briefly talk about standing posture, so that I think that's important, so you, as parents, can know what to look for and how to identify certain areas that may be problematic or even possibly causing some pain. I'd like to also apply that same information and talk about sitting either at a desk or at a computer, because now that kids are back in school, they're spending time sitting at their desks in the classroom, sitting at their desks doing homework at home, or even possibly sitting at a computer. And finally, I'd like to provide some tips about backpacks, because it's getting increased attention now, and in terms of the weight of backpacks with younger children. And I think it's important after discussing some postural alignments to make you aware of what to look for and how to make sure that your child is wearing their backpack safely. So first, I just want to talk briefly about standing posture. When you have good posture, the structures in your body are in the best position to function as they're intended to, and it helps keep these structures, keeps the integrity of these structures. And so I'd like to just briefly highlight a few things that you as parents can look at in your children at home. And I'm just, like I said, I will basically just highlight a few things to look from head to toe so that you can maybe look at areas where your child might be having tight muscles or weak muscles, or pain if they're reporting pain. So I first want to just mention that while good posture is supposed to be nice and upright, tummy muscles, abdominal muscles engaged, right? There are 3 natural curves in the spine. So as you'll notice in yourself, the neck and the low back, there's a forward curve, and then in your mid-back, it's quite the opposite. It rounds out towards the back. So those are 3 natural curves that we all have, and so we're not intended to be perfectly straight. But just a few things that you might want to look at. The first, it says ears in line with the shoulders. So looking at your child from the side view, you can look, are the ears, and I'm not the best example of this, but are the ears and the shoulders in line? So if the ears are slightly in front of the shoulders from the side view, that might show you that maybe your child's head is coming forward a little bit too much, or if the shoulders are coming forward, then you might notice that, you might kind of as a whole notice that they're kind of curling forward, and that might indicate some tightness in the muscles in the front of the chest or some weaknesses in the back muscles. So that's one thing you can look at. And as I mentioned, there is a slight forward curve in the neck and low back. But what I want to emphasize is that while there is a slight curve, you want to make sure that's not excessive, and that kind of goes back to having your head too far forward. So you want to make sure that it's not overly curved in the neck. Also, you want to make sure that there's not excessive arching in the low back. Thirdly, you could look at their hips. This might be a little bit more difficult to look at from with just the plain eye, but you could see if there's really a difference. Is one side of the hips kind of higher than the other side? Or are they kind of posturing a certain way where you can kind of notice that one side is a little bit higher on the waist? That might indicate that maybe there's some tightness on one side, not necessarily at the hips, but it could be coming from the upper back or something in the neck, which is causing further asymmetries lower down the body. You want to look at their knees. Make sure that they're not locked out or hyperextended, so basically that the knees aren't locked in the backwards direction. This just protects the structures in the back of the knee, and it kind of allows them for a more fluid movement when they're going throughout their day. And then finally, you want to look at their feet and see, is the weight equally distributed? So are they leaning more towards the inner edges of their feet, or the outer edges or the outsides of the feet coming up, or are they leaning forward a little bit more so than just right in the middle? Are they on their toes? So, these are just a few little things that you as parents can look at, not necessarily identify what is the structure at fault here, but maybe you can help your child kind of correct their posture and look at just certain things that you may want to consult a professional for. So now that we've talked about standing posture, I'd like to talk a little bit about sitting, because as I said, kids will be sitting in class, sitting at home doing homework, and I'm going to specifically talk about sitting at the computer. Kind of the same principles apply. You want to make sure that you're sitting upright. And, depending on how the setup is at home, I know it's not always easy to manipulate the environment, but if possible, you want to have the top of the monitor or screen either at or below eye level. And so this first thing that I said, head level on neck, having the monitor positioned in the right way will prevent this tilting upward of the head, which may cause some stress in the back of the neck.